Welcome to Ulosca channel. Access all nursing practice questions. BSN HESI 266 Medical Surgical Practice questions with answers.
Question 1. A patient with chronic obstructive pulmonary disease is at risk for which acid-base imbalance? A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. Which one is the correct answer? The correct answer is B. Respiratory acidosis. Explanation. COPD causes chronic airflow limitation, leading to CO2 retention. This buildup of CO2 results in respiratory acidosis due to decreased gas exchange and impaired elimination of carbon dioxide from the body. Question 2. Which dietary recommendation is appropriate for a patient with hypertension? A. Increase sodium intake. B. Avoid fruits and vegetables. C. Follow the DASH diet. D. Eat high-fat meals. Which one is the correct answer? The correct answer is C. Follow the DASH diet. Explanation. The DASH diet emphasizes reducing sodium, while increasing potassium, magnesium, and calcium from whole foods like fruits, vegetables, and low-fat dairy, which helps lower blood pressure naturally. Question 3. Which is a priority nursing intervention for a patient experiencing chest pain? A. Perform a head-to-toe assessment. B. Administer prescribed nitroglycerin. C. Schedule a stress test. D. Offer a high-fat snack. Which one is the correct answer? The correct answer is B. Administer prescribed nitroglycerin. Explanation. When a patient experiences chest pain, prompt administration of nitroglycerin helps dilate coronary arteries, improving blood flow and relieving ischemic pain, reducing the risk of myocardial infarction. Question 4. A patient is receiving furosemide. Which lab value requires immediate action? A. Potassium 2.8 milliequivalent L. B. Sodium 138 milliequivalent L. C. Hemoglobin 14 GDL. D. Calcium 9.2 milligrams DL. Which one is the correct answer? The correct answer is A. Potassium 2.8 milliequivalent L. Explanation. Furosemide is a loop diuretic that increases urinary potassium loss. A potassium level of 2.8 milliequivalent L is dangerously low and can cause life-threatening cardiac arrhythmias if not corrected promptly. Question 5. Which symptom is most characteristic of left-sided heart failure? A. Jugular vein distension. B. Peripheral edema. C. Pulmonary crackles. D. Abdominal distension. Which one is the correct answer? The correct answer is C. Pulmonary crackles. Explanation. In left-sided heart failure, blood backs up into the pulmonary circulation, causing fluid accumulation in the lungs. This manifests as pulmonary crackles and difficulty breathing, especially when lying flat. Question 6. Which nursing action is most important after a patient has a thoracentesis? A. Encourage deep breathing. B. Keep the patient supine. C. Restrict fluid intake. D. Massage the back. Which one is the correct answer? The correct answer is A. Encourage deep breathing. Explanation. After thoracentesis, deep breathing helps re-expand the lungs, prevents atelectasis, and promotes better oxygenation and lung function post-procedure. Question 7. What is a common early sign of hypoglycemia? A. Bradycardia. B. Sweating and shakiness. C. Flushed skin. D. Slow reflexes. Which one is the correct answer? The correct answer is B. Sweating and shakiness. Explanation. Hypoglycemia stimulates the sympathetic nervous system, causing early warning signs such as sweating, shakiness, anxiety, and irritability. Recognizing these signs helps prevent progression to severe hypoglycemia. Question 8. A postoperative patient suddenly develops shortness of breath and chest pain. What is the nurse's first action? A. Elevate legs. B. Call for rapid response. C. Encourage ambulation. D. Increase for fluids. Which one is the correct answer? The correct answer is B. Call for rapid response. Explanation. Sudden dyspnea and chest pain post-surgery may indicate a pulmonary embolism, a life-threatening condition. Immediate activation of rapid response ensures timely intervention to stabilize the patient. Question 9. Which finding is most concerning in a patient with a new tracheostomy? A. Small amount of mucus in tube. B. Occasional coughing. C. Continuous bubbling at the trach site. D. Clear lung sounds. Which one is the correct answer? The correct answer is C. Continuous bubbling at the trach site. Explanation. Continuous bubbling at the tracheostomy site may indicate air leakage, improper tube placement, or a developing complication such as a pneumothorax, requiring urgent assessment by the healthcare provider. Question 10. A patient with diabetes is scheduled for surgery. Which preoperative blood glucose value requires notification of the healthcare provider? A. 120 mg/dL. B. 85 mg/dL. C. 250 mg/dL. D. 140 mg/dL. Which one is the correct answer? The correct answer is C. 250 mg/dL. Explanation. Blood glucose greater than 200 mg/dL before surgery increases the risk of poor wound healing, infection, and postoperative complications, and should be reported for possible treatment adjustment before the procedure.
Thank you for watching. For more practice exam questions, subscribe to our website at www.ulosca.com.